Hi, I'm Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. I am happy to introduce to you the September issue of JVS-VL and highlight 4 outstanding papers which are also freely available for viewing for the next 2 months. The CME article and editor's choice for this issue is a report on the multi-center SECURE trial, a prospective safety and effectiveness study using endovenous laser ablation with a 400 micron optical fiber for the treatment of pathologic perforating veins in patients with advanced venous disease, written by Dr. Kathleen Gibson and co-authors. In this single-arm prospective study, 1 to 4 pathologic perforator veins were treated in patients with advanced chronic venous insufficiency with a 95.2% procedural success using a 1470 nanometer laser with a 400 micron optical fiber. The 10-day primary closure rate was 76.9%. At 12 months, it was 71.3%. Ulcers healed in about half of the patients who had ulcers before treatment. Adverse events were rare and included persistent pain and tibial DVT and 1 death that was unrelated to the procedure. The study concluded that perforator treatment with laser was safe and effective, improved quality of life without any procedure-related major side effects. Our next highlighted article is titled Role of an Age-Adjusted D-dimer cutoff level in the diagnosis algorithm of lower limb deep vein thrombosis in outpatients. It was written by Jimenez Gui and co-authors from Spain. This prospective non-randomized study of 606 patients suspected to have lower extremity deep vein thrombosis using the Wells scale. D-dimer levels were checked and duplex scan was performed. Duplex confirmed DVT in 41 patients at a D-dimer threshold of 250 microgram per liter. Sensitivity was 93% and specificity was 8%. On the other hand, when the age-adjusted cutoff level was applied, global sensitivity was 76% with a false negative rate of 24%. So clearly the authors concluded that age-adjusted D-dimer cutoff levels were falsely negative in 24%, and they are not useful for DVT diagnosis when distal leg veins are routinely scanned. The third article by Dr. Giannezzini and colleagues from Italy and the US is entitled Volume Control of the Lower Limb with Graduated Compression During Different Muscle Pump Activation Conditions and the Relation to Limb Circumference Variation. 30 healthy individuals were studied. They all wore 16 to 20 millimeter below knee compression stockings. Graduated compression with stockings significantly reduced lower limb volume after 30 minutes of standardized walking, sitting, and standing. Limb circumference variations influence the interface pressure gradient. Thus, the authors concluded that for proper fitting with the graduated compression stockings, circumference measurements at 2 separate levels have to be considered. The final article highlighted this month is entitled Acute Superior Mesenteric Vein Thrombosis Results in High Rates of Readmission and Morbidity, authored by Andraska and colleagues from the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania. In this retrospective study, 121 patients had acute mesenteric vein thrombosis, 81 8% were treated medically, 3% underwent endovascular repair, 16% of the patients required bowel resection for ischemia. Predictors of need for bowel resection included lactic acidosis and congenital hypercoagulable disorders. Mortality, when they compared it to that seen with acute mesenteric ischemia, it was low. At 30 days, it was only 3.31%. And at 1 year, it was just under 12%, but morbidity was significant. And almost half of the early survivors needed readmissions, most frequently for abdominal pain. Interestingly, readmission rates were similar between those who underwent medical treatment alone and those who also required bowel resections. These were just 4 of the many excellent papers from the September issue of JVS-VL. You can download them free of charge at www.jvsvenous.org. Enjoy reading all JVS journals and let us know if you have any comments or questions. Thank you for watching and see you next time for the highlights of the November issue of the JVS Venous and Lymphatic disorders.